I was going to take you back to something you said earlier about clotting. Now, there are those who would think, maybe out of ignorance, would think that because the heart is, the rate of the heart is increased,
Yeah.
you should pump blood faster.
Yeah.
So what causes the clotting?
Okay. Now, you could have a fast heart rate, which is regular. You could have a fast heart rate, which is chaotic, irregular. Now, when it's chaotic, we call it atrial fibrillation. That means the heart is just managing to contract. Effectively, no blood is flowing. So you have blood flow, but it's sludging because the heart is not doing this, it's just doing that. And that sets in motion the cascade of clotting. And clotting anywhere is a potential death sentence.
Okay, the ingredients in the energy drinks, are there any particular ingredients that cause or enhance
caffeine.
Clotting?
Caffeine is the one that is, and then there's an amino acid called taurine, which is supposed to work synergistically with caffeine to give you the high that you get. Now, unfortunately, this taurine also has been associated with clotting on its own. Okay? Because in America, I remember Monster drink. A 13-year-old girl was on it and developed a clot. One or two other people, and I think maybe it's been banned or there's some legislation on it. Okay? One or two patients who are hypertensive, who are my patients, I actually told them, stop taking energy drinks. Because they're coming, taking their blood pressure, and their blood pressure in 200 over 120, that range. And two of them, after stoppage, blood pressure dropped. Okay, so now, anybody who's hypertensive, I would not.
But, sorry, let's look at caffeine. There are those who are somewhat addicted to coffee.
Tell me about it.
And I know someone's laughing. There are those who are somewhat addicted to coffee.
Yeah.
Then there's the energy drink. So let's weigh the two of them.
Okay, a can of energy drink is supposed to be like about 2 or 3 cups of coffee. A can of energy drink is equivalent to about 2 or 3 cans of coffee. Now, it also depends on how sensitive you are to the drug. Like, take for example, 2 patients, one takes 10 milligrams of Valium and is still wide awake, and the other takes 2 milligrams of Valium and is knocked out. So your body, the way your body metabolizes the drug also is important. So you might take 5 cans of energy drink and not feel anything. Not feel. It doesn't mean there's no damage going on. And you might just take half a can and you are energetic, you are jumping everywhere. You can't sleep, you can't eat, you can't concentrate. Okay? Caffeine is a stimulant. Okay? Caffeine, if given intravenously, would cause your blood pressure to rise. Your eyes will be charged, you'll be awake, you'll be wide awake. Whether you can operate efficiently is a different thing. My experience, I couldn't.
So it really doesn't even guarantee.
It doesn't. It does not guarantee
a
that
better mindset for you to concentrate.
Exactly. It does not.
But
it does not.
The individual stays awake.
Awake. You can't sleep, and it's very frustrating. Because I've experiences. It's very frustrating. You can't sleep. You keep reading the same line over and over again. So
mixing energy drinks and coffee.
Now, when you mix energy and coffee, then you are increasing the concentration of caffeine. And so the effects will be worse.
Besides the increased heart rate, I'm sorry to bother you. Besides the increase, what other effects are there likely to be?
The heart rate, your blood pressure. No, the main targets are your blood pressure, your heart rate, and the way your heart beats. The other effect is that because it's preparing you for a fight, you don't feel hungry because you're not certainly going to eat when you are going to take up a challenge. You don't pass urine. You don't even feel like going to the toilet to defecate. So all those things are inhibited, while the ones that prepares you for this vigor is heightened. Yeah, heightened.
Does caffeine increase the risk of heart disease?
It does.
It does.
I tell my patients who are hypertensive to avoid coffee. Good thing we now have decaffeinated coffee, which gives you the odor, but it doesn't give you the kick.
So just in case you like the
just
flavor.
In case you have the flavor, I tell them, do decaf. Okay? Cigarette will do the same thing because it contains nicotine. And the sad truth is that some of these people smoke as well. So you take energy drinks, you take it with alcohol, you take it with coffee, and then you smoke. And you are having an additional problem. And you see, because people die here, and most times the fight against post-mortem, we can't really assess the situation, the extent of the situation.
You know, Prof, allow me to come in here. Though there's a question specifically for you here from Taiwo. He says, or he or she says, well, ask the Prof his take on the consumption of codeine mixed with, well, maybe a soft drink. He mentioned the soft drink. We don't want to mention the name now. A soft drink now. Yeah. Codeine mixed with soft drink. How risky?
Well, if you mix it with a soft drink like Coke, Fanta, you're actually going to dilute the effect of the stimulant inside, because although Coca-Cola too has a little bit of stimulant, but if you mix it with Fanta or Sprite, then you're going to dilute the concentration. Okay. My take is that don't even take it.
Younger persons these days, how often do they come to you with cases of high blood pressure? You know, once upon a time, it used to be a case of maybe you talked about the 50s, 60s, yeah, but now we 40s. Get to see younger persons come with cases of...
No, the rate of hypertension in adolescents and in children it's not increasing alarmingly. Okay. We have two types of hypertension. The type 1, which it's inherited, your father has it, your mother has it, you are obese, you are diabetic, you are obese, you don't exercise, okay, and that's genetic, that's something you acquire. The other type is the type 2, which is caused by specific things like kidney disease. So when you see a young person who comes to you with hypertension, he probably has another condition which causes the hypertension. And if you catch it early, and treat that condition, you can actually cure the blood pressure. But as you get to the age of 40, you develop the type 1 hypertension, which is the one you acquire from family and things like that. Young people use these energy drinks because they are not hypertensive. Because they are not hypertensive, it probably won't have a very overbearing effect on their blood pressure. Okay, but on a long-term basis, the possibility of cardiac heart disease is high. It hasn't been proven. I'm just being proactive. Because if you take this energy on a continuous basis, the heart is working twice or 3 times as hard. Eventually, it's going to develop what I think will be a heart muscle disease, where the heart just says, the muscle just gets flabby, and the patient comes in heart failure.
And the risk of having blood clot, does it have
the risk of blood clot is higher.
Does it have any sign, any symptom that you're just going to have it before it comes?
Unfortunately, it's usually a sudden thing. Like if you have a stroke, if you have a clot in the brain, it's a stroke. It's sudden. Bam. Okay? If you have a clot in the coronaries, that's the vessels that supplies the heart, it's instant heart attack. If you have a clot in the kidneys, the kidney develops, gets damaged, because these are tissues that require blood to survive. And in about 2-3 minutes, if you don't get blood supply to a living tissue, it dies.